third question is from Dr. Bob Osborne. How is the evolution of the dental industry affecting the business model in terms of relationships to the public?
Dr. Osborne, good question. In fact, great question. It's a mouthful for sure, but healthcare is becoming more and more relational. And so that's where the business model is going, and it's going to have to go. And so the biggest challenges out there for healthcare, and I'm putting dentistry in that for sure, is learning how to speak people. Learning how to speak people, not speaking the language of healthcare, but speaking human, speaking compassion, speaking empathy, speaking simplicity. That's what healthcare has to do, and that's where the business model has to evolve with. Is I am choosing healthcare professionals based on their ability to know me and to slow down enough to get to know me. I am very much not interested in a quick process and this machine of pushing patients through and just diagnosing and treating and they're out. That's not my version of a trusted advisor, trusted professional. And so that's what I'm looking for. It's interesting because, it's been a decade or more, but there was a really great JAMA article, the Journal of the American Medical Association, JAMA, that came out, and most of us know this. Most healthcare clinicians know this article, but it talked about the link with malpractice suits, that doctors got sued for malpractice. Those lawsuits weren't based on clinical competence, they were based on a lack of communication. So the doctors that got sued more, there was no difference in clinical competence. That wasn't the deciding factor. It was literally the doctors who spent less time with those patients got sued more. And when we think about that, it makes sense, right? When we feel like we've been misdiagnosed or we've had a problem with treatment, it's been because the physician or the healthcare specialist didn't listen to us. They didn't take the time to communicate. And so I think that is going to be one of the defining factors, the shifting of the model. I think we're already seeing it majorly in healthcare. I think we're going to have to follow suit with that in dentistry. And honestly, I think it's a really, really good thing.